Hi everyone. In honor of Movember, a month that is known to raise awareness of men's health, I'm going to kickstart a series called Men's Health Mondays, where I post a new video every Monday of this month raising awareness about common men's health issues. Again, this is not meant to be medical advice. The goal is to raise awareness about various health issues in hopes to encourage others to have this conversation with their primary care provider. With that being said, let's get on with today's video, which is going to be about prostate cancer. Again, this is going to highlight general information about this condition. This is not going to be very comprehensive. If you want further information, I encourage you to speak to your primary care provider, i.e. your nurse practitioner or family physician. So what is prostate cancer? Prostate cancer is the abnormal growth of cells in a man's prostate gland. The prostate sits just below the bladder and it makes part of the fluid for semen. In young men, prostate is about the size of a walnut. As men age, the prostate usually grows larger. Most cases of prostate cancer are diagnosed in men older than age 65. It usually grows slowly and can take years to grow large enough to cause any problems. As with other cancers, treatment for prostate cancer works best when the cancer is found early. Often, prostate cancer that has spread responds to treatment. Older men who have prostate cancer usually die from other causes. Experts don't know what causes prostate cancer, but they believe that your age, family history, i.e. genetics, and race affect your chances of getting it. So what are the symptoms? Prostate cancer usually doesn't cause symptoms in its early stages. Most men don't know they have it until it's found in a regular medical exam. When problems are noticed, they are most often problems with urinating, but these same symptoms can also be caused by an enlarged prostate or benign prostatic hyperplasia. An enlarged prostate is common in older men. See your primary care provider for a checkup if you have some of the urinary symptoms such as not being able to urinate at all, having a hard time starting or stopping the flow of urine, having to urinate often, especially at night, having pain or burning during urination, having difficulty having an erection, you have blood in your urine or semen, you have deep and frequent pain in your lower back, belly, hip, or pelvis. So how is prostate cancer diagnosed? The most common way to check for prostate cancer is to have a prostate-specific antigen blood test or a PSA test. A higher level of PSA may mean that you may have prostate cancer, but it could also mean that you just have an enlarged prostate or an infection of the prostate. If your PSA is high, you may need a prostate biopsy to figure out the cause. A biopsy means that your doctor or a primary care provider takes tissue samples from your prostate gland and sends it to the lab to test. How is prostate cancer treated? Your treatment will depend on what kind of cancer cells you have, how far they've spread, and your age and general health. You and your family physician may decide to manage your cancer with active surveillance or to treat it with radiation or surgery. If you're over the age of 80 or have serious health problems like heart disease, you may choose not to have treatments to cure your cancer. Instead, you can just have treatments to manage your symptoms. Choosing treatment for prostate cancer can be confusing, so make sure that you speak to your primary care provider to give you guidance and provide more explanation about the treatment options that's best for you. If you enjoyed this week's video about prostate cancer, please give it a thumbs up and share it with a family member that may want to see this video and educate themselves and maybe encourage them to have a conversation with their primary care provider. Thank you so much for watching, and we'll see you on the next Monday for the Men's Health mini-series.